Hi, my name is Glenn Boyd, and I'm doing my skin assessment demo for Health Assessment 1. And this is Peter, and he'll be helping me. And so, to begin the skin assessment, you start just by looking at the skin, looking at the color. We're not going to take any of his clothes off to look at all of the skin, but we'll look at things like I'm looking at his arms now. You're looking at color. Um, First, you begin by doing hand hygiene. You wash your hands, which I've already done, and you explain to the patient what's going to happen. Usually this happens with your whole head to toe assessment. You check the skin out while you're assessing all the other systems and everything. But just to isolate it, you start off, you check out the color. Is it like normal color for their um, for their ethnicity? When you push down, does it go back to does it go white and then go straight back to red or pink? Things like that, like blanching. You're going to check for moisture. Is it really dry or like do they have diaphoresis where there's a lot of moisture? Um, when you're checking everywhere, you're going to check for like wounds, lesions, anything of that nature, and kind of document the findings on those. And then you'll also check areas like the back of the head here, the bottom where the sacrum is at, the bottom of the heels, like any bony prominences where there may be pressure ulcers forming if they're like been in bed for a while. Um, Also, you'll look around at the hair growth along the body and is it normal and is there any abnormal growth or anything like that? And you can ask the patient about that. And then next, you're going to palpate the skin. You're going to feel around all on the skin to see if there's any like excess fluid, like edema, um, how the temperature feels. Like, is it warm to the touch? Do they possibly have a fever or do they just come in from outside? Things like that. And then you're also going to check the turgor, which is where you take and you pinch the skin. And if it tense, they are dehydrated or have low elasticity in their skin. But his Peter's pops right back down, so he's hydrated, which is good. Good to know. That's after you've looked over all the skin everywhere. You can also check the turgor right here on the sternum, under the shirt, obviously. Um, and then the next thing you're going to want to check are their nails. So you're going to check here, and you can press down on the nail to check for capillary refill, just to see, does it go kind of like a blanching? Does it go white and then back to red? Things like that. The shape, are they clubbing? Are they normal color? Because if you see any blue, that might be cyanosis. And the texture, like are they brittle or normal feeling? Um, and these nails are good. There's good capillary refill too. So the nails are good. And the next thing you're going to want to inspect is the hair on the head. Is it breaking off? Do they have good hygiene? Is it brittle? You kind of check all of that. And then that's hair, skin, or that's skin, hair, nails. The next thing you're going to want to check is the head and neck. And a lot of things you look at for on the head and neck are things symmetrical? Is anything uh, poking out like it shouldn't to? Like you could have a goiter on the neck, and it could be like you could have jugular vein distension, and it could point out here. So you want to see, is everything symmetrical? You're going to want to check the lymph nodes here on the neck. You're going to want to check the head shape, which you can do when you're checking the hair as well. Make sure it is fully rounded and there's no knots. Um, and then you're going to want to check uh, movement. So, like, are they doing any abnormal movements? Like, are they twitching or anything like that? And then, um, and then on the neck, can they move their? Can you move your head left, right, up and down? Sweet, sweet, sweet. Um, and then things like that. You want to check to see if their jaw is clicking, anything like that. Usually you can do that when they're talking. Some of this stuff can all be done simultaneously while you're performing other assessments. But that would be your assessment for skin. Thank you.